Barrowland and acknowledge elders past, present and emerging. I'd also like to acknowledge anyone with a lived or living experience of mental illness or any carers in the room. So thank you for everyone for attending. This is our new service provider induction training for our PHN. The reason we have decided to start doing our induction training, this is the second one we have run, was that there is quite a lot of, I guess, information specific to our PHN that we would like our commissioned service providers to know when they're delivering our mental health services. So we might start with, already done the acknowledgement, our agenda today. So if everyone could please have their cameras on, and at the end of each section, we'll be having some questions. So if you have anything, just write it down and you can bring it up on our allocated time. The first session will be going from 10 to 11:15, and then we will stop for a lunch break, and then we'll be moving into session 2 from 11:35 to 1, which will be specifically on Ready Case. So I'd like to start with some introductions. Given there is quite a few people, we might just go around, and if you just say your name, your role, or I guess the program you're working for in your organisation, that will be great. I might just have a read off the top of my list. So I might start. I am Rachel. I work at the PHN, and I'm one of the mental health coordinators, and I look after the psychosocial and intake portfolio. I might get Sophie and Veronica to also introduce themselves. They'll be co-presenting with me today. So over to you, Sophie.
Hi, I'm Sophie. I'm one of the mental health intake officers. I've probably spoken to lots of you already on many occasions. So yeah, looking forward to getting into it. And I'll be mainly doing the Ready Case section. So lots of fun. Thanks for joining.
Hi, I'm Veronica. I'm a mental health intake officer and I've been with the PHN for 2 months.
Thanks, Veronica. Okay, apologies if I read your name wrong. I'm just going to go down the list in the chat. So we have Aldo Moroni.
Hello, everyone. My name is Aldo, and I work with One Door Mental Health as an intake officer. Thank you.
Amanda Matai. No, she might have her.
Sorry, did you want me to introduce myself? I just came in.
Oh, yes. Hi, Amanda. Sorry, I'm just reading down the list. It's in alphabetical order. We're just doing introductions. So just name the program you work for, an organisation.
My name's Amanda and I work for One Door Mental Health, but our organisation is Head to Health in Liverpool.
Head to Health. Great. Thank you. Angela Spithill.
Hi everyone, I'm Angela. I'm from Gamindara Health Services in Liverpool, and we're doing a program on mental health and AOD, a combined therapeutic program, mainly aimed at our Aboriginal and Torres Strait Islander community here in Southwest Sydney.
Great, thank you. Ben Gilholm.
Hey, I'm Ben. I'm from One Door Mental Health in the Connector Hub program.
Thank you. Emma Connell.
Oh, hi. I'm with Community Links Wellbeing, based down in Bowral. We've been part of the Community Bushfire Project for the last number of years. That funding's now come to an end, so I find myself in mental health intake.
Okay, thank you. Erin Stuckey.
Yeah, hi everyone. I'm Erin Stuckey, Manager Psychological Services for DCJ and Southwestern Sydney districts. We're doing a bit of a service enhancement program as a bit of a partnership with health. So hence me being part of this PHN. Thanks.
Thank you. Gillian Onslow.
Hi everybody, my name's Gillian. I work for Jade House at Karitani, the perinatal infant child mental health team.
Thank you. Jeswyn, Joseph? Oh, he's got no voice. He works for our team. He's our housing and mental health service navigator, attending, but currently no voice. So welcome, Jeswyn. Kay Sauter?
Hi, I'm Kay. I work at Karatani as the manager of the Perinatal Infant Child and Mental Health Service. Hi, everyone.
Louise Lovell?
Hi everyone, I've probably spoken to most of you here, but if not, my name's Louise Lovell and I work at South Western Sydney PHN. I'm the mental health project coordinator here.
Thank you. Lynette Toms? No, that's okay. Nicola Hickson?
Hello.
Oh, Lynette, you there?
Hi. Hi, I'm Lynette Toms. My company's Connection Emotion Reflection, and we have a contract to provide counselling services for Aboriginal people in Macarthur, Wallandilly and Wingecarribee.
Thank you. Nicola Hickson?
Hi, I'm Nicola. I'm a psychologist working at the toddler clinic within Karatani in Karama.
Thank you. Nikki Jordan?
Hi there. Hi, everyone. My name's Nikki Jordan. I'm a manager at Grand Pacific Health. We have the Way Back in Campbelltown and Headspace Liverpool.
Thank you. Pandora? Healers?
Morning, everyone. Hi, Rachel. I'm Pandora Illes from Wandor Mental Health. I'm an operations lead within that organisation, and for today's purposes, I support the low intensity CBT new access program for South West Sydney. Thank you.
Thank you. Renee Puckridge?
Yeah, Mum. Hello. I'm on Wiradjuri country out west. I have my camera off because we've got storms out here, but I'm with Stride. I'm the Stride peer workforce leader, and for today I'm here as part of the Connector Hub. Thank you.
Thank you. Renee McCook?
Hi everyone, I'm Renee and I work at Karatani with Jade House. Thank you.
Great. Val Birch? I think you're still on mute, Val.
Oh, don't you hate that? Sorry, I'm Val. I work for the Primary Health Network and I'm the Mental Health and Alcohol and Other Drugs Advisor.
Thanks, Val. And Veronica, we've already done you. So was there anyone we missed? It's quite a long list. No? Excellent. Great. Well, thank you, guys. It seems, we've got shows the kind of diversity of our services that we commission across the region. So, yeah, welcome and thank you, everyone, for joining. All right, we will move on. So we're up to session 1. So who knows what is primary care? You guys all work for you're commissioned under the Primary Health Network. Does anyone know what primary care is? Any guesses? No?
That's
Come on.
us at Ganangara, we're primary care. Health
Do you know what it is? What it means?
First line of care before you go into the public system or hospital system.
Yeah, that's right. So it's the services received outside of hospital and within the community. So there's a basis on health promotion, prevention, early intervention and treatment of conditions and management of chronic conditions. So often the cornerstone is general practices, community health centres, allied health practices and communication technologies such as telehealth and video consultation. So we all work as a part of the primary care sector. Okay, so we're obviously Southwest Sydney PHN. So PHNs were born probably coming up 6 years ago now as a part of the mental health reform, and it was to support primary care services for all residents in our region. And our aim is to provide the right care at the right time by the right people in the right location. So we cover the 7 local government areas of Bankstown, Liverpool, Fairfield, Campbelltown, Camden, Wallandilly and Wingecarribee. So we're quite a unique PHN in that we have a mixture of really urban high needs areas and also some rural areas down from Wallandilly and Wingecarribee. So yeah, and obviously we've got really high needs and low SES in pockets of the area, as well as quite isolated regions in some of those Wallandilly and Wingecarribee areas. So yeah, compared to other PHNs, we are quite unique. We've got our information and contact there. And if you see there's a little link, we will be sharing this PowerPoint down the bottom here. This is a link for find your local PHN. So there's a map finder for the whole of Australia for which PHN you cover. So as I said, in 2014, the government undertook a review. The Mental Health Commission conducted a national review for mental health programs. And in response to that, the PHNs were born. So previously, this PHN was the Medicare Local, Southwest Sydney Medicare Local, and then there was a big, I guess, tendering process, and then we moved across to the Primary Health Network. So in response to this, the government's responses included the prevention, early detection and treatment of mental illness, prevention of suicide, and to reduce the burden of disease caused by mental illness, particularly through primary healthcare approaches. So we are funded through the Department of Health. So yeah, PHNs exist all across Australia, and we get, particular buckets of funding to support mental health in our region, and we do that through a stepped care approach. So as you can see from everyone who are attending the training today, we have a number of different mental health programs who operate right from emerging low needs up to complex and high needs through a stepped care approach. So stepped care is just basically that people can receive the service relevant to their needs, and as they improve or they might have increased needs, they can step up and down through the services as needed. So there's two funding streams. So as most people know, we have better access, which is, you can go to your GP and get a mental health care plan, and that's available to all Australians with a Medicare card. There often is a gap fee. And then there is also funding through PHNs through our stepped care, and that is for only defined populations groups. We do not get enough funding to cover the whole of the region. We just have particular cohorts who we are funded to support, which we will go through. So these are all of our priority areas as a PHN that we receive funding for and have a focus on. So stepped care, so that's supporting the whole stepped care approach for our region, low intensity mental health services, psychological therapists, therapies for underserviced groups, mental health care services for people with severe mental illness, a regional approach for suicide prevention, Aboriginal and Torres Strait Islander mental health services, child and youth services, joint regional planning, and psychological treatment for people in aged care facilities, and support for people, psychosocial support for people with severe mental illness. So all of the programs that you guys work for would fit under one of these mental health priority areas. So as I said, we operate in a stepped care approach. So there's different levels within stepped care, and it starts right from self-management. The next step up is low intensity services. Then we've got moderate intensity up to high intensity, and then acute and specialist mental health care services. So it is evidence-based, and it's a stage system comprising of a hierarchy of intervention from the least to the most intense, which match the individual's need. And as I said, the idea behind stepped care is they can step up and down as their levels of intensity change across their recovery. So how PHNs operate is we commission providers. So first of all, it starts off with a needs assessment. So we have a yearly needs assessment that we do for our region. It's available on our website if anyone is interested, and that has a look at what are the unique needs for our regions, what are the gaps, what are the priorities, and from there we design our programs from that. So often what happens is we will get some funding for our particular cohort, and the PHN is to design the service requirements. We often start with, after the needs assessment, we do a co-design of service requirements. So we work with, service providers, carers, consumers, CMOs to design what exactly we want this service to look like. Once we come up with what we want the service to look like, we go out to procuring. So it's generally a request for tender, which is a competitive process where NGOs can apply to tender for the program. So once we go through the selection and contract service, we go through contract negotiation, and then the program commences. Once program commences, we do ongoing monitoring and program development and evaluation, and then the cycle starts again. So does that make sense? Did anyone have any questions about that? Good. So at the moment, we are tendering for a few. We've got 2 Headspace centres that are currently going through the procurement process at the moment. So yeah, the programs will be launched first quarter of next year, which is exciting. Okay, so I might hand it over to Veronica now. We thought instead of going through all of our services one by one, we might do some case studies because you guys are clinicians and it's probably more engaging for you. So do you want me to keep sharing my screen, Veronica?
Yes, please. Yeah. Okay, I'm just going to put the link to our brochures in the chat because I think that probably some of you weren't available on Friday when I sent the link through, so it's just there. So you've got 2 case studies, 10 minutes to review them and to work out what programs you want to allocate the clients to. A few little hints. Case study A, look at You in Mind peer support, You Access, Headspace, Odyssey House, Head to Health, Dr. Telepsychiatry. Case study B, look at things like YIM, Connector Hub, NDIS, social engagement, carers. Now, the PHN don't support a carers program. So if you guys use any resources or if you know of any people, we're open to that. Put it in chats. One of the ones that I know of, or 2 of them, is Carers New South Wales and the Family and Carer Mental Health Program. Also looking with that gentleman's physical health concerns or illnesses, look at things like credentialed mental health nursing service. Okay, so you've got 10 minutes. So we are at 20 past now, 10:30. We'll see you back here. Okay.
Hi there. For those that joined, we're just working on a case study at the moment. So you'll see in the chat there's a link to our mental health and AOD brochure. So we're having 10 minutes to look at the brochure and also any other services that you have knowledge of, and we'll report back with what services and supports you would look at referring this person to.
Yeah.
Okay, how do we all go? All good? All right, so case study A, who'd like to give me some of their answers on what programs they thought were suitable? Any takers? No, nobody feels comfortable to do it?
I'll go Veronica.
Okay.
I was going to take a stab, but okay.
Oh, there
You can
go.
do
You go.
B if you want to. One of you can do A, one of you can do B.
I'll do A.
Okay, where are you?
Hey.
There you are. Hi, Ben. Okay, what are you thinking?
Sorry. So I'm thinking because of the child's needs as well as the mother's needs in this process, that it would be good to sort of start them off with new access and stars for kids. That way, there's a bit of mental health coaching for the mother, but also access for for the child who's displaying symptoms of depression as well.
Sure.
And then later on, potentially for the mother, once further down the track for the mum, and the needs of the kid is being supported potentially into the Connector Hub program for further supports and social engagement, depending on how it depends on how it's approached in the coaching phase.
Sure,
So, yeah.
sure. With the Star for Kids, they actually only go up to 12. So what you'd probably be thinking about for this age range would be Headspace.
Yeah, sorry.
They'd probably, no, don't be sorry, because, you know, a lot of our programs have very similar bases. So, you know, it's something that unless you're doing it all the time, you're not even going to know. And this is the thing. So look, that's actually really, really good. And you've got, you know, your UN Mind and you've got your peer support, which can give
guess
assistance.
Depending on how, I think new access is the starting point for the mother at least.
Yeah.
And then depending on what their needs are beyond that, because it's a
grade up
when you
or
look
down.
at the service, because the new access is sort of that starting point because she's got phone video options because she's not leaving the house anyway. So there's that factor of it, and of which case it's about sort of building the capacity to eventually be able to leave the house and potentially engage with groups. Hence why I'm saying that the Connect Hub program is that potential stepping stone for her later down the track.
Absolutely. No, I think they're all really, really good ideas, and there's just so much available. You've got Odyssey House as well. They can do residential programs, but they can also do external programs too. Consultant psychiatry, because she's quite severe, and there's a number of things going on, particularly with the substance abuse and chemical changes in the brain and things like that that can lead on. Well, that's absolutely fabulous. Okay, so we'll go on to case study B. Thanks, Ben. As our case study
Does
B
anybody
person.
else want to have a go, Veronica? Only because I'm from South Western Sydney PHN, so I thought
If you'd like to have a go, you're more than welcome to have a go. What
Does
were you thinking?
anybody else want to have a go before I do?
Okay.
No? Okay. So for B, I had down the Connector Hub, Southwest Sydney Connector Hub, as an option. And also for the carer, you know, Carer Gateway Services or Carers New South Wales for ongoing support.
Certainly, One Door Mental Health has a fabulous carers program, which could be of assistance in this case. It's mainly for people who are caring for others where their primary mental health concern is anxiety and depression. So they're a really, really good resource as well. You've got the UN Mind program for your psychology, which is fabulous, the Connector Hub for your social engagement, and your NDIS suitability discussions. Consultant psychiatry again, because this gentleman is actually quite severe and also for his physical concerns, so the diabetes and the hypertension, the credentialed mental health nursing service
And the nurse, yeah.
service.
I had that one as well.
and they just bring everything together, you know, and can really help him to manage his mental and physical health needs. Yeah.
So there's so many options available.
Exactly. It's just
yeah.
a wealth, and a lot of
Which
them
is
have
really
a basis that is so similar. So, you know, and I mean, what we do in intake is we'll look at the referrals coming through, and if we think that there is a more suitable program, we'll contact the referrer and have a discussion around that. So there's never a wrong allocation. Yeah, so thank you guys for that. That's all done and dusted.
I guess it would depend if there's any wait lists and things like that. Do you find, Veronica,
Look,
as well?
there are wait lists at the moment,
Yeah.
to be fair. At this stage, I'm aware of our service providers. We were initially at, I think, 6 to 8 weeks. Now I believe we've ballooned to 12 weeks. So, and as Ben said, you know, new access is a fabulous starting point. If people are in need, there's always something that they can work on. And I know it's low intensity cognitive behavioural therapy, but it is a really, really good wait out program while you're waiting for something that's more in line with your concerns. So yeah. Anything else that anybody else would like to add? No? We all good to move on?
You've also got Head to Health.
Head to Health, yes.
Yep, that can be used in both those cases.
Absolutely, particularly for people who can't leave the house.
Correct, and we, I shouldn't say we, that gives it away, doesn't it? They offer that stepping stone for in between 3 to 6 months, linking in with services more long term, and can assist with Docatella referrals, which is like for psychiatry, for diagnoses and medication.
So is there a waiting list there at the moment, or is there a wait list? Are we okay there at the moment?
Docatella, I think.
For Head to Health?
Head to Health, no. We're basically taking referrals as they're coming in. Liverpool, we're getting quite a lot, so I'm actually moving this week from Bankstown to Liverpool. So
okay.
Yeah.
All right then. Well, that's a really fabulous resource. I mean, Head to Health has always been a great service. So thank you for bringing that up.
And that can work for like the son, the mother, also linking in with carers support for that, and for same thing with case study B for him and his wife as well. Same deal, that they can both access that service.
Okay, perfect. Thank you.
The other, sorry, I'm going to jump in and also say,
okay,
because
this
there's
is great.
that identification of NDIS as well, Connector Hub can assist in
That's
relation to
right.
the application process. So so we deal with a number of cases where we're supporting some of the psychosocial behaviored, not behaviored, sorry, let me rephrase. It's a psychosocial mental health inability that we can assist with for application, or which case from there we can assist.
Yeah, definitely. It's like that starting point, isn't it?
Well, I mean, service navigation in the NDIS sector is a little bit choppy at best, if I may say.
Yes, yeah, definitely.
But a lot of the Connector Hub, a lot of the Campbelltown Connector Hub guys have experienced at least 1 or 2 different cases for NDIS access, and particularly there's a few of us, including myself, that have a bit of knowledge in the physical and also the psychosocial side of the access components of that. So a lot of the Connector Hubs are also in the same boat where they've got at least some form of knowledge for access. So we can easily assist and guide them through that process of what supporting evidence they need.
Yeah, and I've got to say One Door does offer a range of services for people. So it's sort of a bit like a one-stop, which is good. Yeah. Okay, anything further? No? All good to move on? Okay, so let's go to slide 15.
Sorry, I'm trying to move it. Why is it not
It's
moving?
not moving.
Oh, there we go. Okay, yep, that was just the virtual.
Yep. So meet the team. Okay, so this is fairly self-explanatory. You've met Rachel, our psychosocial and intake coordinator today. Sophie, you will meet after me, and then of course me, the mental health intake officer. And we've got Damien Burke, so he's psychosocial support, so doing things like liaising with Connector Hub. Devendra Sapkoda, he's a service navigator. We often get calls from people who aren't really sure what they want, aren't really sure what would be useful for them. So Devendra will walk them through that, have a conversation, and then actually put them in touch with the correct services. Then we've got Jeswin, he's a service navigator for patients with mental health concerns where homelessness or emergency housing and things like that are an issue as well, and he can help them with that. Kate, the program advisor for New Access, Staff for Kids, Headspace and Reframe. David Donatini does the clinical suicide prevention service. You in Mind Moderate, Connection, Emotion, Reflection. Pritika Desai, she does the credentialed mental health nursing service. Docatella Psychiatry, and You in Mind High. And we've got Val, who's our program advisor for mental health and alcohol and other drugs. So let's go on to slide 16. Oh, sorry, I've forgotten Alina. Don't forget Alina. Alina is the initial assessment and referrals officer.
And myself,
Sophie,
Veronica, and Louise.
yes, where are you? There you are. And we've got Louise. She's the mental health program coordinator. Part of her role is to engage with non-government organisations with regards to community disasters such as bushfires and floods, among other things that she does.
Yeah,
and
head to health as well.
That's it.
Yep.
And Jade Widener, she's our overarching manager of the team. Okay. So 16, slide 16. All right, so we've got the referral process. So referrals are processed within 3 business days and allocated to the service provider. The service provider will contact the patient within 5 business days with an aim to have an appointment booked in 4 weeks. Although our service providers do have a waiting list at the moment, so this may be delayed. I will put a link in chats for you now for the referral that you can use for that. When you're submitting referrals, mostly they come in through eFax, which you can see our number there, but I can put that in chats for you as well if you would like. Let's put that there. There we go. It's come up all funny. I'll fix that up later. Then we've got the clinical suicide prevention service referrals. So they're processed within 24 hours of receipt, and the patient will receive a call from the clinician within this time frame. An appointment will be scheduled within 3 to 5 business days. So I've got a link for that too, but I might just put that in afterwards just in case we have that little thing that's happened there.
Veronica, it should be okay. We can just send around the PowerPoint and all the links are embedded.
Can you do that?
In there. So yeah.
Thank you.
Yeah,
okay.
The PowerPoint will be embedded.
Great. All right then. Other health professionals can refer into programs like You in Mind, and they can do that by completing the online mental health form. With this method, clients will receive, and for all our You in Mind programs, clients will receive the first 3 sessions without a mental health care plan, but beyond that, a mental health care plan will be needed to release all the rest of the sessions. So if that's You in Mind Moderate, that'll be 12 by 1 hour sessions. If it's You in Mind High, that'll be 18 by 1 hour sessions. And that's it. So thank you so much, guys. And then it'll be on to Sophie for the next portion.
Did anybody have any questions on our referral processes before we move on? So there is, the GPs are still doing generally by our eFax, and all of our provisional referrals are by our smart form. Anyone have any other questions on that?
I do have a question, please.
Yep. Often
Uh,
questions come up with referrals. Thought I'd open it up.
So I'm a bit uncertain as an intake officer. Someone called in at One Door Mental Health and are interested in you and mine. They have a referral. Should I do all the process or refer that person to you guys to PHN intake service? What would be ideal?
Normally
Right.
you would do that.
Can I answer
Yeah,
that?
it's
Right, yeah.
expected.
So that if the referral was from a GP, like say they have a GP referral form, you can either, I guess, you could send that over to us, but if you're doing the referral, like say they call up and they do the referral with you then and there, that would be considered a provisional referral. So you would enter in that referral.
Okay, so
Yeah.
provisional, I'll do it myself.
Yeah.
All right, thanks for that.
Just a comment as well that although the mental health services, the social emotional wellbeing programs at Farrell and Gandangara are not through intake, they're directly to those services, and all of the AOD services are also direct referrals to the services.
Thanks for mentioning that, Val. That's really important. On our website, it does go through all of our services, but it also goes through underneath the service. It'll say how you can actually refer, like how that person, the client, can be referred to that service. So yes, we commission a lot of services, but we don't do the referrals for a lot of them. So if you're on the website, you want to have a check through. Obviously, in our brochure, most of them that can be referred to via us, but there are a couple that can't. So just keep that in mind. It'll tell you what the referral process is on the brochure and on the website if you wanted to know. Cool. Okay. Rach, did you want me to share or are you happy to keep going?
I'm good.
Yep. Okay, perfect. Thank you. Okay, so we touched a little bit on IAR. Pretty much the IAR is it's pretty much a decision tool. So the objective to that is to enable a national consistent evidence informed initial assessment and referral process in primary care settings, supporting a step care approach. So in our, it's pretty much deciding a level of care. So in our smart referral form, depending on what you choose as your role description, the IAR might come up or it might not, but pretty much based off the answers that you put in, it will come up with a level of care, and that'll determine whether or not the referral is appropriate for services within the PHN, or if the level of care is probably more appropriate for example, community mental health, or a high level of care that's outside of the PHN services. So it's a really handy tool. Alina, as mentioned before, has come on and is implementing that and also educating some of the GPs as well on that. So eventually GPs will use that tool as well. And she does do a workshop, which is really, really helpful. So the information is on there. If you'd like to do that workshop, it's really, really informative. So as we said, we're going to share the slides, and it's got her information on there. So if you wanted to reach out to her and find out when she's next doing a training session, and you can also go onto the link as well, and it'll kind of break down that IAR. We could probably spend a long time on it, so I'm just kind of skimming over it a little bit. But if you wanted to learn a bit more about it, then feel free to go onto the link and have a look through. But it's a really, really helpful tool.
Yeah, and also you will probably see it's already embedded in our smart form. So if you are doing our referral through Educase, through the smart form, the IAR is embedded into it. They're the questions, and then there is routing in the back end that tells you based on the level of support they need, which services are most appropriate. So yeah, it is going to be rolled out nationally and to GP. So it will be something that you guys will probably hear about a lot in the next, coming couple of years.
Yeah. And as mentioned, it'll depend on the role description as you put in a referral into the smart form, it will come up for some roles, but not necessarily others. So just keep that in mind. Okay, thank you. So other important information, I'm just going to quickly go over these. We kind of touched on the service navigator a little bit. So we have Devendra and Jeswin. So pretty much if someone or a referrer or the client is not sure what kind of service that they need, there's obviously a lot of services out there, and it can be quite confusing to know what's available and what's appropriate, what's going to suit that person's needs. So their role is to link the person in with services and also give lots of information. So it might be a matter of, here are the services that are available, not necessarily just within PHN. There might be services that are appropriate outside, and they can give that information to the client and also the referrer, so GP, provisional referrers, carers. So pretty much kind of a starting point of where do I start? That's kind of where Devendra and Jeswin will come in, and obviously Jeswin also focuses a bit on the housing side of things. So yeah, we're really happy to have those roles in. It's fantastic. So and a document that was created, the link there will take you to it on our website. We noticed, I think it was probably about last year, we noticed that we got a lot of referrals for neurodevelopmental and behavioural disorders. The PHN is not funded to have services specifically for those. Obviously, people do have comorbidities, but the main reason for a referral through the PHN needs to be mental health related. So if the main reason is for neurodevelopmental behavioural concerns, that's pretty much a link to something that a few of us in the team put together. It goes over services that may be appropriate. It's got some really good links in there. It breaks it down into infant, child, adolescent, and adults. And there are also some psychological and psychiatry services in there as well. So it kind of covers quite a lot, and it's a really good resource to have if you've got someone who has presented and you think, oh, we kind of might need to be getting some support for this person. Not sure if the PHN necessarily will cover that, so let's have a look at that list and see if there's something that's more appropriate. So it's a really good resource if you wanted to have a check on that. Yeah, so it particularly is around ODD, ASD, ADHD. We especially get a lot of referrals that come in that are specifically for ADHD, and just remembering that, especially for like staff for kids and psychiatry, the main reason of the referral does need to be mental health related. So they're kind of the two that we get a lot of referrals for that are for yeah, like ODD, ASD, and ADHD. So yeah, have a look at that resource. It's a really good one. You're more than welcome to share it with others if you think that they'll benefit from that. And yeah. Did you want to? Thank you. Oh, sorry, I should have added, there's also a link to out of area. Rachel kind of touched on this before. The PHN locator is fantastic. That is also in that neurodevelopmental and behavioural resource down the very bottom. If you're not sure if a client lives in the Southwest Sydney area, that's a really good resource to use, because you can actually put either their suburb or their full address into there. We often get referrals for like Western Sydney or like areas outside of our PHN. The main like referral, I guess, eligibility is that the person will live in Southwest Sydney. So if you're not sure, put that address in there, and that'll be really helpful in, I guess, putting forward whether or not the person lives in our area or what PHN they're under, and it actually has that PHN's details that will come up, and usually a website and an email. So you can have a look, contact them, they'll have their own mental health intake, and they'll be able to direct you to services that are appropriate for that PHN. Just note that they might have similar services, but they're not called the same thing usually, and there's slight differences. So just keep that in mind. Does anyone have any questions so far? Hopefully I'm not talking too quickly. No? Cool. Okay. Am I handing it over to you now, Rach?
Yeah, we might have a 5-minute break. So if everyone
Yep.
wants to like grab a coffee or do whatever, we'll convene back at 10 past 10 and continue on from there. So I'll see everyone soon.